Code of Ethics, Part 2, Medio IGC 101, Unit 4. Okay, I am Dr. Isabel Souza, your presenter for this one, and we can go on to the slide to continue our conversation. So, non-judgmental attitude. What does it mean to be non-judgmental? It's actually an important skill that we should learn. In order to be culturally competent, we actually need to be non-judgmental. So what it really means is that, we're sort of pausing judgment on an issue. And there's two ways to do this. Either we have a personal opinion about something and we remind ourselves, well, Isabel, the person isn't here. It's the professional. And we try to separate our views. And the professional interpreter doesn't have judgment. And by doing that, we're just parking that judgment elsewhere. That's one way to do it. The other way to do it is to start thinking of having a multi-dimensional scope of ideas where we start to understand that different people look at things differently. And by being bicultural and bilingual, obviously interpreters already have an edge on this because we know things are different. And while we might appreciate them more in one or the other culture, we understand that it's not a matter of right and wrong always. It can just be a matter of doing things differently, of seeing things differently. And if we can have two views of the same issue, that is the beginning of a non-judgmental attitude. So, an example is just, you have to do exercises for this and really think of not, how can I not judge someone? Well, even though you see something, you don't see the entire picture. So I think about this story I read in a book of a person seeing this mother sitting on a train and not minding her kids. Her kids are yelling and screaming and being incredibly inappropriate, and she just has a stare and isn't really addressing it. And most people would look at that parent and judge and say, well, why aren't they taking care of their children? Why isn't this mother doing anything? And so the reason we're judging is because we don't have all the information. Maybe this mother is coming from a funeral and her husband just died and her children are, misbehaving, but she just doesn't have the energy at that moment. She is completely distraught. She has no idea how she's going to live and provide for these children. So what we see is not the entire truth. And the more we think about this, even when we're interpreting for our patients and our providers, what we see is not the entire story. And so we have to reserve judgment until we know enough. And as a professional, we really will never know enough. So we really need to park that judgment elsewhere. So let's move on. But non-judgmental attitude is very, very important. Now, this is another important concept in ethics, and that's the client self-determination. It's the agency that individual has to make their own decision. There's a very high value of independence in our country, in the US, more than others. But most people value their sense of sovereignty. They value who they are and what they bring to the table, and they want to be able to make their own decisions. Unless you're a child who doesn't know what this looks like, once you become an adult, you do know what independence, at least you have an idea. So as an interpreter, we have certain options, but we have to remind ourselves that the parties we're working with, the patient, their family, the provider, and any other allied professional, we are interpreting for them so that they can communicate, so they can self-determine, so they can express what they need to express. We're not there to help them directly. We're there to help them communicate. There's a big difference. If we think we're there to help people, we might take on attitudes or behaviors that are even patronizing because we're trying to do their job. So a patient's job is to express themselves, take care of their health. They're actually there at some health institution attempting to solve their problem. So we need to value and respect our clients, or the provider and the patient's ability to govern their own ideas and their own behavior and their own communication. Remember in the beginning I said we're there to respect the voice of the parties we interpret for. We can't do that if we take on anything that really is theirs to take. So even when we know and we want to explain something, we always confirm it with the party, with the patient. For example, is this what you meant? And, is this what I'm understanding? And if the patient confirms it, then you may wish to say, well, I would suggest you explain this to the provider right now, and I will interpret. And then you go back into your interpreting mode and you allow that patient to provide that explanation. This is a sign of respect. Now, on occasion, the patient might look back at you, might not have the skills, or might be intimidated and not want to, or not have the terminology to do it. And they might ask you to, explain what you just understood. And as an interpreter, we can do that. But we always, always have to ask the party for confirmation of our ideas, and also for, give them always the opportunity to self-correct or self-explain or self-communicate instead of us undertaking that. So that's incredibly important. It's one of our ethical tenets. And as we've stated many times, you cannot offer personal or medical opinions. That would be a huge breach of what we're doing. We can really only offer linguistic or cultural opinions related to our area of expertise. And why is that? Because everybody has their own area of expertise. Our area of expertise is the languages we speak, the cultural, information we have about those languages. The area of expertise of the provider is the medical knowledge he has and the opinions he's going to provide, the diagnosis he's going to provide, and the patient has their own area of expertise, their body, their symptoms, what they're looking for, and what they consider the best outcome. So our only outcome is to provide accurate and complete communication so that they can have their own healthcare outcome. But it's not our outcome. So self-determination is very important. So let's go on to the next slide. Our attitude towards clients. Well, certainly those relationships have to be based on professionalism and trust. Gaining the trust of our parties is very important. And the only way to gain trust is not by doing favors. It's not by being chummy or friendly. It actually is by being professional, friendly but professional, and maintaining an equidistance from both parties, so neither party feels that you're more connected to the other, so they don't feel left out. They're the ones that need to be connected to each other. We need to respect the patient's autonomy and the provider's autonomy as well. But oftentimes it's the patient autonomy that gets overlooked. We need to address our own biases and really be mindful of them before we, start practicing. And when we do feel uncomfortable, to really control our body language, and then, do some self-reflective work to understand why is it that we're not leaving those biases behind. And that if we really rooted in our purpose of treating all patients the same, if we've committed to that ethical tenet, we're going to have a hard time justifying any bias. And then, all these things, are part of an interpreter's professional demeanor. The demeanor is how we address each other, how we stand, how we sit, how we communicate, how we interject, and maintaining a high level of professionalism is going to be incredibly important in our work. So let's move on to the next slide. Accepting assignments. The majority of code of ethics address this, and this has to do with when not to accept an assignment. It's basically the fact that we can only accept assignments for which we are qualified and capable of doing. So we don't accept assignments when we're not technically qualified. So the language or the subject matter is foreign to us. And we really need to be mindful of this, because oftentimes providers or systems might kind of want us to interpret in a language for which it's just not working. I'll give you an example. Many times I was asked to interpret in French to Haitian patients who, they said they spoke French, but the French, was not at a level where I could really communicate with them accurately. So in that scenario, I had to recuse myself and say, I'm sorry, but the communication is suboptimal, and I'm not doing a service to this patient or to your communication with him. We will need to get a Haitian Creole interpreter. So that's a situation where you actually even start a scenario and then you have to step out of it. Or subject matter. Maybe you walk into a room and, it's a clinical trial consent form that happens to be 20 pages long. And it's for a disease that is a rare disease, and it's a very new procedure. Technically, that would be an incredibly difficult assignment to undertake without proper preparation. Okay? So we can also be uncomfortable with the situation due to an interpersonal or an intrapersonal issue. Unfortunately, that could happen. Maybe the provider, has mistreated you in such a way that you don't think you can provide a proper interpretation. Or maybe it's the patient that has mistreated you, or something has happened. Or maybe it's an intrapersonal matter, an internal matter. For example, it's an abortion clinic, and you're actually going to be interpreting for the procedure, but you just happen to have had it a month ago, and you're just not ready emotionally to handle that. So it could be so many issues, but it doesn't happen that often. But if it were to happen and you feel that you will not be able to interpret professionally, accurately, and completely without making mistakes or just having a breakdown, you would have to recuse from that assignment. Conflict of interest. We cannot interpret for family members. I hear so many interpreters before they get trained typically say, I interpret for my parents, and that's how they get into the field. But after you get into the field, you respect that. You don't interpret for friends or family. Why? Because you can't be unbiased, and you can't have two roles at once. You can't be the supporter of the patient and also the interpreter. Because by having that strong connection with the patient, you're already creating a disbalance of those relationships. So if there's a conflict of interest, you have to disclose it. So what to do? Well, the interpreter needs to be professional and truthful about the situation, and be mindful before it happens. Ideally, we don't accept assignments, when we're given the assignment, not when we're in the room. And that's why preparation and knowing something about it can be very important. So let's go to the next slide. Other ethical considerations. Compensation. Interpreters cannot be compensated by an agency or a healthcare organization, also by the patient. That would be incredibly unethical. Double dipping is unethical in any profession. We need to only accept professional pay, and we need to be compensated according to our abilities. We can't be forced to provide free services, and pro bono work is done at the discretion of the professional. So any nonprofit that starts saying we need interpreters to volunteer, well, that's not cool, because they're paying for catering, photography, venue, but they're not going to pay for the interpreter. That's a problem. So just be mindful that pay can be an ethical issue. Overcharging, not charging for time you did not interpret. Those are huge breaches of ethical considerations. Then we have the issue of gifts. Sometimes patients in different cultures might come with a gift, and it becomes a difficult situation. Providers will rarely accept gifts, but they encounter the same problem. So an unethical gift would be anything of monetary value, jewelry, something that is more than just, it just gives the impression that now you owe that person something. It creates a personal relationship that shouldn't be there. So that can be difficult and should be explained away, and interpreters who are professional will have no problem in explaining. I'm very appreciative of your gift, but I cannot accept it. My professional code of ethics doesn't allow it. That's a simple way of doing it. Acceptable gifts could be gifts such as, a loaf of bread, or something very minor that the patient put together that isn't of monetary value. And in certain cultures, not accepting the gift could actually be more detrimental to your relationship than accepting something small. But that's very different from something of monetary value, or a gift that's wrapped, and that could start becoming a problem because it creates that closeness. Self-evaluation. Interpreters really should continuously self-evaluate their work, self-evaluate the situations at hand, and realize that there are different levels of training. A 40-hour course on interpreting will barely edge the introduction to the profession. So be wary of 40 hours comprehensive course, because there's nothing comprehensive about something so short. Attend continuing education, continuously grow. We'll talk more about that later. An unethical declaration of skills and credentials is another very bad breach. And that is because what are we most tempted? We're tempted to say we can accept things or assignments that we're not really ready for. But actually declaring that we're certified or qualified, some interpreters might put a QMI behind their names as if that were a credential, but it doesn't exist. Unfortunately, there is no QMI credential. So if somebody puts that credential beside their name, they are misstating, and it's an unethical declaration of skills and credentials, because those credentials don't exist. Or stating that you can interpret in languages for which you cannot. That is a very big problem. It happens more between Spanish and Portuguese interpreters. Spanish interpreters are constantly asked to interpret for Portuguese interpreters, and they do. And that's unethical. So we need to, keep that in mind. Just because you're asked something, it doesn't mean you need to say yes. We need to stand our ground as professionals and know how to react in every situation. So let's go to the next slide. Professionalism. What's the definition of professionalism? Well, a professional is someone, typically, if you look up a dictionary definition, it's an individual who has studied certain number of years and a skill and has certain knowledge about providing a service. And it's professional if it meets certain standards. For example, ethical decision making and no ethical violations. A professional will follow an ethical tenet and will uphold that. There are various forms of interpreters services. You have the independent contractors, freelance interpreters who work for several organizations, maybe one or two remote interpreting agencies. You have staff interpreters who work in hospitals. These interpreters are typically in an interpreter department within a hospital, part-time or full-time. You may have on-call interpreters who are per diem interpreters who only go in when they get called. We used to get called in a beeper. Now we all have our cell phones and different systems that we can use to engage with our clients. The majority of interpreters are freelancers, although in medical interpreting, there's still staff positions. Then we also have remote interpreting and face-to-face interpreting. And right now the field is at about half and half, but remote interpreting is growing, mostly due to the fact that providers can't wait. Their typical appointments are 15 minutes long, and they just can't wait 5 minutes for that interpreter to walk through the door. And sometimes that's the time it takes for the interpreter to walk from one office to another. And they don't have that time. So remote interpreting is really becoming the norm. And we'll discuss more, when it's appropriate to use each. Contracts are very important. Professionals use them. You should always have everything in writing. Even if it's by email, you want to confirm your rates, your process of working, if you charge no-show fees, if you charge rush fees, if you have a minimum number of hours, whatever it is, you need to expose that and be very clear. I think transparency works in all situations to avoid communication problems. You want to always communicate what's happening. If clients contact you directly, that's fine. But if you're working for an agency and you have the hospital calling you, you need to inform the agency. Transparency. The hiring party needs to be informed of any communication between you and the requester of the service. Continuous education, I mentioned it already. If you're certified, you will need it. And one of the levels of professionalism that's becoming a norm now is certification. All medical interpreters should be certified. There's really no excuse to not be certified. And certification will require continuing education. But we're getting to a point where medical interpreting is not so much in its infancy anymore, but it's in its adolescence. And if you're not certified, are you a professional? Because a professional typically has a credential or a license to practice. So it's something for all to think about. We can call ourselves professional, but we're only professionals when we're, doing everything that profession offers us. We're affiliated with a professional association. We're credentialed by a professional organization. We're acting on the ethical standards of the profession. We're, using contracts and upholding our professional demeanor at all times. And we're maintaining our skills by doing continuing education. Those are all very important aspects of professionalism. So we're going to end this slide here, this unit here, and I thank you very much for listening.